Dear listeners, welcome to Faces of Digital Health, a podcast about digital health and how healthcare systems adopt technologies. I am your host, Tjasa Zajc, and today you will hear about building communities in healthcare. There can be many reasons to build a community around your product, to expand your network, get valuable connections, get direct feedback from your users, get ideas for improvement, and raise customer satisfaction. Building communities is time-consuming and demands special soft skills. I talked to Aline Noizet, digital health connector with rich experiences of building and getting to know communities in the digital health space. She started her digital health journey in a digital health startup in Barcelona before becoming an important part of Health 2.0 and later Bayer's G4A. Aline and I discussed the digital health ecosystem in Barcelona, where she is currently based. She talked about what does it take to build and sustain a community and what role does she play in startup development as a digital health connector. Enjoy the show or read the recap on our website www.facesofdigitalhealth.com. Aline, I usually start with very specific questions, but for you, I want you to introduce yourself for those that don't know you yet in the digital health community, though I doubt that there's many people that wouldn't hear about you.
I would describe myself as digital health connector. So that's kind of me, and that's also the company that I started. So my website is live now. When I was studying, there was an event where students were meeting startups for summer internship. And just by chance, because I was speaking French, I got to meet that company that I started working with. That was called Doctoralia. And my first day into the job was actually a conference in Madrid where you had hundreds of nurses and doctors who were blogging and tweeting and sharing best practices. That was absolutely amazing for me. And that was actually the journey. That's how I started. I absolutely fell in love with the industry. And a few months after that, we started the Health 2.0 Barcelona chapter. And then that was it, from one conference to the next, and from building communities. And so that was actually 2011. So it was 9 years ago. I should say that I think I got also lucky in terms of timing, because when I got in the industry, so 2011 was when things were really starting to pick, and they were really looking for experts in innovation, of people that can really make a difference and lead the way.
What's your reflection on all these years? How have startups changed? Has the mindset changed? Has the approach to building solutions changed in any way?
Yes, a lot. And I think something that I remember very well was how it evolved through the Health 2.0 conferences. So I joined Health 2.0. It was 2014. And I co-organized a Health 2.0 Europe conferences for a few years. And we clearly saw the evolution there. So the first years...
In what sense? What was changing?
So the first years, the startups were showcasing solutions, but they had trouble, the solution was not adopted by the system. So they came with a solution, but without a client. A few years after, we really saw the solution were being adopted. Hospitals were using the solutions in their premises. That's where we also saw the pharma getting into the game, starting the accelerator, so starting with Bayer, and slowly after the insurance companies. The startups were developing solutions more focused on needs. At the beginning was more okay, I've got an idea, let's make a product. But a lot of them realized that was not working. So more and more startups were starting more from the bio design, identify your need and build a solution for that need.
Do you also observe any changes from the user side? So how are hospitals, doctors, nurses, patients acting towards what's being presented to them?
When I think back when I started, I think we were missing some education. All that was new. And it was scary, if you're a doctor or nurse and someone come to you and present you that solution, but people were not necessarily explaining the benefits for them and how to use it. So when it's something new, like you're scared, and it makes sense, it happens to all of us. And I think things evolve in a way that there were more education. Those healthcare professionals and nurses got to understand better. They got taught better how the solution can actually be implemented in the system and how it can help them. And I think also those healthcare professionals and nurses got more involved in the process. That's something also very important, like you need to get them involved because they're going to be using your solution. So coming back to what you were asking before, that's something that we also saw much more. So at the beginning, the startups were coming and say, yeah, that's our solution. And you ask them also, was it validated by the market? And say, yeah, well, we can't find any clients. I say, yeah, but did you talk to doctors like along the process? Was it validated? Say, no, we didn't talk to them. And that changed actually. After that thing, the startups were talking earlier, really involving healthcare professional, nurses, and patients now way more in the process. And that ensures that those solutions actually what the market is looking for. So the success rate is much higher, reaching the market.
Since you got into digital health, one of your specialties basically was building communities. How does one even start? For example, if you want to build a community of nurses or doctors, which are to a certain extent skeptical about technology because it's at the moment causing them a lot of pain.
So I would say it's not about you, it's about them. So get to know those people. If you come with your big shoes and say, I want to sell you something, that's my product, this is not going to work. Like you need to understand them. And also a good way to start, a good way to start a relationship with those people is to get them involved in the process of what you're doing. Saying, I've got that idea. What do you think about it? Would you like to be involved? Would you like to give me some feedback? That's very important. Like when you build a product, you get them involved, but don't just go and see them when you want to sell them something. And I think how to meet them. So some nurses, healthcare professional will go to conferences. So that's a good starting point to meet them. I think social media is another one. If you go on Twitter, like there's a very active community there. So that's also a way to make connection. I think it's all more about connection. You make connection with people, and that's how you build your community.
We tend to say that culture is more important than innovation, so if you don't tackle people, you're not going to be successful. So from that perspective, knowing how large organizations, hospitals are, do you have any advice in terms of how can you try to spread a specific solution among those that are really skeptical and resistant towards new implementations?
I would say try to talk to those people. Try to understand why they are reluctant. In many cases, what I've found those past years is that those people are reluctant because they don't really understand like the education part that we're mentioning before. If you sit down with them, like you would do for like a solution, try to understand their problem. Why don't they want to use that solution? And try to get to know them better. I think create that will take more time, but I think it will be very useful because maybe that's kind of a different target group and you need to adapt your solution to that target, and other people are going to follow that specific person who is reluctant to adopt your solution.
What would you say is the role of online communities and social media in sustaining these communities? So if we talk specifically about doctors or nurses, and they might not necessarily be on Twitter or LinkedIn, how can you encourage collaboration or staying in touch with them online?
I actually found out that the healthcare communities, so doctors, nurses, are quite active on Facebook. So they use Facebook for like the private use, and also they join some groups that are interest to them for work. So that's a way to, that's something that I always recommend, when you develop like an online, when you develop an online strategy, Facebook should be part of it. Really consider Facebook as an important element to reach out to the healthcare professional.
What does it take to sustain a community?
It's like, we say when you're looking for investment, you shouldn't go and talk to the investors when you need the money, but you should really connect with the investors way before, and you create a connection with the investors. You create a relationship, and the investors are here. They will accompany you along the way. They will get to know you. They can give you some feedback, some advice. And the day when you're looking for some money, they're here, and the process is going to be also like faster. And the same when you, if you think that you're successful and you stop talking to the community, that's a mistake, because it's going to slow down your growth, because you will never, even if you're a successful company, you will never stop needing access to the market. So I think that you need like a strong anchor. Like normally if you have someone like a strong figure who will be here, who will like bring those people together within the community, that will talk to the community regularly, that will make the people from the community feel important and feel that they exist. I think that's essential. And if you lose that, that's kind of the glue that will bring them together. Yeah, that's when you lose the community.
But are these community managers, let's call them like that, do you think they're valued enough? Because, bringing people together goes among the soft skills. So you can quickly have, a CEO or a decision maker that is going to say anyone can do that, when in fact that's far from what's the reality.
Well, I'd say that, yeah, you're right. It's a lot of time. It's a lot of effort. I've been leading the Health20 Bono Barcelona community for 9 years now. And it is a lot of work. Like, it's time out of your free time, where you really need to constantly keep the people together. You need to innovate also in the way you do things, like trying to understand what your community want. How can you serve them? Because I think that's very important. It's not about you, it's about them.
Perhaps we can stop here for a while longer. Maybe you have someone who wants to get close to the users. What kind of different approaches can you take in order to make people be interested in what you're trying to do to help them?
Again, I think that should come from them. If you're trying to like kind of force someone to do something, that's not the right way to do things. So maybe try to understand what's the interest of this person. What do they want to hear? Maybe the format is not right. And maybe if they don't come to all the events that you're doing, all the activities, that's fine. But just find something that can really bring value to them.
Can you maybe tell me a little bit more about Barcelona Health 2.0 chapter? So what kind of activities do you organize for your community? What's making it successful for so long?
So we organize events. So we started organizing events every 2-3 months. The usual format was 3 startups that were pitching their company, so presenting to the audience. So that was giving them a stage so they could get visibility, and the audience knew what was happening around them. And we're actually very, very happy because a lot of collaboration came out of those meetings, because there's always 2 parts. So first part, it's like the formal part of the presentation, and second part we always get a bit of like a food and drinks, so people can really interact and create connections between them. And a lot of collaboration happened during those events. And that's the thing I'm like the most proud about when we talk about Health 2.0. And also, like the startups that we're mentioning before, we had to evolve and to adapt to that evolution of the startups and the space. And now I think the events we are doing are more education, what's happening in the space, and entrepreneurs sharing their experience with other entrepreneurs. So one of the very successful events that we did about 2 years ago was a session on investment, where we brought different profiles. So we had a VC, an incubator, a business angel, and all those people share their experience going through those different form of getting investment or growing. And that's something like still today, the members remember that session as one of the most successful.
Are there any differences that you could mention in terms of, so Health 2.0 Barcelona is a local chapter, but you were also involved, Health 2.0 was a global organization before it got acquired by HIMSS, and G4A is also a global organization for startups. How was community building different on that scale?
So with the Grants G4A community, it was more built around Bayer and the different teams. So it started in Berlin and then it expanded in different cities and countries. And I think the goal of those G4A was more to bring closer the Bayer community, the Bayer people, with the local startups. So they could understand, they could get inspired by the startups, and they could also think of new ways of how to improve their business locally based on the issues that they were encountering or just how to improve business. And Health 2.0, I think, is a bit different because it's more focused on startups, how to help the startups. So Health 2.0 originally was created to give a stage to the startups and to showcase the latest innovation in healthcare, like putting them in touch with investors, with pharma company like Bayer, or with insurance company, and also creating collaboration between the startups themselves and for them to learn from each other.
You now started a business. You call yourself now the Digital Health Connector. Tell me a little bit more about that. So what does a connector do?
For me, a connector actually connects the dots between the different actors in the healthcare ecosystem. So I'm more focused on startups. That's my passion. That's what I've been doing since the very beginning. And I want to help the startups growing. And for that, I think they need to know the right people in the space. Like, what do they need to do when it comes to regulatory, for instance? What do you need to do? Who can help you? Then when you want to connect or build those communities, who should you talk to, etc.
So how do you know who's the right fit for who? There has to be an incentive for both parties to work together. It could hurt your reputation, if you referred any startup that comes in contact with you to the investors that the investors would stop taking you seriously.
I work with people that I like, with projects that I'm passionate about. So I don't choose any project. That's the luxury that I have today. I can choose. And then the match, but that also comes from years of experience in the space. But you need to understand, well, when it comes to investment, what are the investors looking for? Like in terms of profile of the company, how much money are they putting in the companies? And then you understand the startups, what they do, what they're looking for. And I think I'm lucky to have kind of a special skill in my head to connect those people. That's like my magic sauce, I'd say.
Can you think of any negative experiences that you had so far, or maybe not negative experiences, but really difficult situations that you were in, hard nuts to crack in terms of connecting different stakeholders?
Well, I think people need to understand that connecting is like, it's a lot of work. It doesn't just come like that. Like, the network that I have today that is necessary to be a connector is like years of work and connections that I built. And those connections are more like personal relation that I made with the people. I know the people. And sometimes people come to you like startups and they just expect you to give everything for free or to just have access to that as if it was something natural.
It's similar to what I said before, perceiving, connecting as something that anyone can do.
Yeah, but I don't think it's the case. I think you need a lot of empathy to connect people. You need to listen to the people, but really listen to understand what each part is giving and needs. And maybe also something that I found difficult in the past when I connected to people, because I really saw, like for me, it was clear that those people had to meet and I could really see like what they could do together, but those people didn't. So they met and nothing happened. And then they even told me that it was like a waste of their time. That's something also like a learning for me, that when you connect someone and you see something, you need to be very clear on where you see the connection between those people, like the potential between those people.
Okay, so did anyone ever ask you if they felt that they didn't get a good match? Did they ask you like, why exactly did you think that we could work together well?
That was a big learning for me at the time. That's when I realized that putting people in touch is not enough. Like you need to really prepare each of them to give them a good introduction of who are the people and where you see the potential between the two. What can they do together?
Can you tell me more about the digital health ecosystem in Barcelona? Where is it based? How often do you meet? What's happening in the community?
The ecosystem has been like very active for like since we began in 2012. We really maintained like an active communities all those years. And the great news is that the Barcelona Health Hub was born last year to really consolidate the ecosystem. And I think that's really what was missing here. Barcelona Health Hub is it's a co-working space focused entirely on healthcare. So it's a big building where you will find startups, pharma company, insurers, investors, all related to digital health. It is located in the beautiful Sant Pau Art Nouveau site, which is today a museum, and it used to be the former Sant Pau hospital. It is today a UNESCO World Heritage, and it's just an amazing piece of work, amazing piece of art. And what's incredible is that hospital at the time was built for the poor people, so that they could actually feel well and be like come to a place that really look bad gestures. And it's like, you have to come and visit us. It's not something that you can get here listening to the podcast. You really need to come and see by yourself.
You mentioned that the Barcelona Health Hub is active for a year now. Do you already see any specific results? What are the plans on how is this organization going to be developing? What is the practical value that it's bringing? So we heard about the idea, what it's supposed to bring. What about the results?
So we already organized several events. So we had the Barcelona Health Hub Summit, like the annual event that happened in October. And in December, we had the first Investor Day. And I could say, those were two big successes where the idea was really to bring together corporate companies and startups from the healthcare space. And we succeeded to that. And people are talking because they met at those two events. And what's in store for the coming month or the coming year is really to make Barcelona Health Hub more of an international hub. So to connect the hub with other international hubs across Europe and across the world, to increase the synergies and to help like both the companies from Barcelona to go to the world and for the world to come to Barcelona.
Given that you're in the digital health space for over 9 years, can you tell me what is your reflection on 2019? Are there any events that really impressed you or kind of surprised you or stuck in your mind?
In 2018, when we talked about 2019, what I was expecting, one of my predictions was that voice and AI would be strong. And I'm happy to say that I think I was right on that. So for me, a big thing, a big milestone from 2019 was Alexa Amazon becoming HIPAA compliant. And I think that will make a major difference. We'll have more voice and AI solution active in the space. Like an example of a skill that was launched by Alexa is now you can connect your prescription with your Amazon account, and Alexa is going to send you reminders to take your pills and also to refill your prescription. Another thing that really marked my year 2019 was it was a few months back. There was a young French guy who was able to walk again. So he's quadriplegic. So he's like paralyzed from the shoulders to the bottom. He can't walk. And on that day, he was able to walk using an exoskeleton. But the magic of that is that he was controlling the exoskeleton himself with his brain. So they implanted a sensor in his brain that was reading the brain waves. So he was giving the directions himself. And I think that's absolutely amazing. And I can really see more things like that happening in the future. And you can think of people today that can't express themselves because they got into accident or they lost abilities. And using our brain as an interface, we would actually be able to communicate with those people, to know what they want, what they don't want, etc. And another thing that I think was an important and another thing that was very popular in 2019 was TikTok. Have you heard of TikTok?
No, actually. I mean, I've heard about it, but I never used it. So
they're actually short videos, like lip singing videos. They last 15, 30 seconds. They're pretty short. And they're especially popular with the Gen Z. And it's been used quite a lot in the healthcare community among the OB/GYN, the gynecologist doctors, and the ladies who are suffering from infertility issues. It's been really taken over, so they can share that issue, they can support each other, they can empower each other, and say that example of a patient who's been trying to have a baby for 9 years, and the healthcare professional told her that she could never have a baby, but she did. She was really resilient. So she's really sharing that experience on TikTok and motivating other ladies, like, don't give up. It can happen. And she's sharing how she changed a diet or things like that, to really help them. And then you have those gynecologists that in a very funny videos. TikTok is always very funny. Like, you really have a good time when you look at those videos. And they are just, educating the people on what you should do or not do, even as around women's health. And what I find interesting is that it's also a way to reach those people who are at an age when they're trying to decide what they want to do when they grow up. And those gynecologists actually also sharing what the job looks like. So that can inspire young ladies or young boys to become gynecologists in the future. So I really encourage you to check TikTok and to try it yourself.
You've been listening to Faces of Digital Health. Find out more about Aline on her website, www.thedigitalhealthconnector.com. And as always, stay tuned, leave a rating or a review wherever you get your podcast, and subscribe to be notified about the next episode automatically.